In the US, there are 43 million screenagers. Using our technology, more than half of screenagers reported feeling anxiety, depression, and suicidal thoughts in the last 2 weeks. Alarmingly, LGBTQ screenagers report even higher rates. Aloha, I'm Noe Foster, co-founder of HealthTechApps. Our story began 10 years ago with 3 native Hawaiian co-founders. We are on a moonshot mission to heal a generation, and we're starting with screenagers. Who? I know you know a few. Screenagers are teenagers and young adults who experience much of life in front of a screen. In the US, there are 43 million screenagers. Using our technology, more than half of screenagers reported feeling anxiety, depression, and suicidal thoughts in the last 2 weeks. Alarmingly, LGBTQ screenagers report even higher rates. To achieve our moonshot mission, we need a rocket. We've created a rocket, a mental health rocket called MindKloud, and we're launching it next month in March in both English and in Spanish. MindKloud is an AI machine learning platform built on our published patent technology for brain health baselining. In 3 minutes, MindKloud captures, computes, and communicates mental health symptoms and triggers along with social determinants of health metrics. Our machine learning then digests all of that de-identified data and creates data stories for our enterprise customers, for universities, health organizations, sports teams, employers, federal agencies, and others. Our screenagers have reported that financial challenges are one of the biggest experiences that they've shared in the last year. Here, 70% of them reported financial challenges. What's cool about our technology is the data stories that we're able to produce, and we're able to produce them because we collect selfie videos with people responding to prompted smart questions. One screenager reported back, the hardest thing I accomplished in the last year was trying to find myself again, being surrounded by people I didn't know all the time, and just everything else that was going on in the world. I lost. Another screenager talked about his experience with making a turkey for the very first time and how cool that was. With all of that de-identified data, it provides really a lot of value. And what we're offering people is a way of experiencing that power from the data over a 30-day period. So we're inviting enterprise customers, potential customers, to try out our 30-day MindKloud discovery session. Here's how it works. The organizations who are interested in signing up for our Moonshot Mission Pledge become part of the We, and over the course of 30 days, their tribe, their customers or their members use our technology for free. And after the 30 days, then we contract with these organizations with a paid contract, multi-year paid contract to scale their adoption, as well as to continue to give them the de-identified data stories. Screenagers want to feel safe with their thoughts and safe from the paralyzing fear of the known and unknown, safe not to have all the answers, and safe to be able to explore possibilities. MindKloud creates a safe place for screenagers to land as they navigate the challenges of life and new frontiers. Thank you.
Thank you so much. How do you position yourself against other companies addressing youth mental health through apps on the phone?
Definitely, it's. I think our sweet spot is by the selfie videos and using our AI to be able to capture unique insights. I'll give you an example. Our baseline question includes what's something difficult that you've experienced in the last year. When we reviewed the video, we learned 95% of the screenagers at the end of the video, after explaining what they accomplished, they smiled. Even though they had noted very high incidences of anxiety, depression, or suicide thoughts, the memory of the triumph made them smile. those kinds of insights helped us to iterate MindKloud. So not only are we capturing mental health challenges, more importantly, we're capturing mental health resilience and
Yeah.
tying that with triggers and empowering the screenagers in that way.
I know you're early in the process, but what is your thought around a strategy for usage, for just getting young people to actually answer the questions when you're competing with TikTok and Twitter, et cetera?
Absolutely. Well, we currently have multi-year contracts with universities that we've been partnering with. We also have a partnership through the Empowered to Serve program with the American Heart Association with a Hawaii grantee, and working with them and school-based programs to attract screenagers to use the app.
You mentioned the production of data stories, and I love that term. If you think out as you grow and scale, what are some of the additional ways that you could imagine these data stories being used to positively impact people's lives?
Definitely, there's so much that's revealed in the data stories. One thing we learned is that death of a loved one is something, a shared experience that many of screenagers have experienced it. Being able to share those insights with counseling centers, with organizations that focus on the treatment as well as the support systems, is really critical. Understanding intimately the challenges and the life flow of these screenagers, we get that. I think that's a huge opportunity for us and for us to share those insights with others.
Very nice. And then a final question. I'm just curious, how did you get here? Tell me what the key experiences were of you and your co-founder that sort of led you to this point.
Sure. 10 years ago, we were working on a project for Mental Health America, specifically looking at transition issues for National Guard soldiers post 9/11. What we did learn is many of them had experienced combat traumatic brain injuries, and that led us to our very first app. That we expanded our experience with that and focused a lot with sports concussions. We worked with major league teams as well as high school and collegiate star athletes. And with COVID, we saw an even greater need to apply all those new learnings to mental health more broadly, specifically anxiety, depression, and suicidal thoughts.